So today we are going to see tissue processing in oral pathology lab. So these are the specimen or tissues to be processed. These are grossed and kept over here. This is the grossing procedure. We gross it, take the picture. Then these are the alcohol changes we give. This it is kept in alcohol for 45 minutes for 3 changes. Then xylene changes for every 30 minutes. Then this is the machine which contains wax, paraffin wax. Then this is how the block is made. After 2 hours the tissue is embedded in paraffin wax and the block is made. This is the procedure how block is made. The tissue is removed from the cassette, that is white one cassette, and kept in this block. We can see over here the process is going on. Now the tissue is being removed from the cassette. Very carefully this process need to be done, so the tissue damage should be avoided. See, we are doing it very carefully. So we remove that cover of the cassette. We remove that tissue. We take the tissue together. There are multiple bits of tissues present now, so we gather them together. Now we take this tissue and put it in the block.
Multiple bits.
First we pour a melted wax in the block, which is purely melted, totally melted liquid paraffin wax, which is put in here. We fill the block till the edge. Then we take the tissues, we place the tissues. Tissues are oriented properly, considering the epithelium and connective tissue of the tissue. They are oriented with the help of the forceps properly into the wax, into that block, into the molten wax. They are orienting it. Now orientation has been done properly. Now we are closing the wax with the lid of that cassette. First we have to pour wax again, molten wax over the tissue. So the tissue get properly placed into the wax. Now we will close it with the lid.
सिंगल बनवू का तेवढं नाही सर आता आपल्याकडे,
so that the molten wax flows out into the cassette lid.
सर बोले जोर से नहीं करना है. हाँ ऊपर से डालूंगी ना.
Now we can pour the wax again onto the lid if the wax is incomplete. So this is the block which we used for placing our tissues. This is how it looks. These are the prepared blocks after drying of the wax next day. This is the block with the tissue. Then slides are made by cutting this block. Then this is what we see in the microscope and diagnose the disease. Thank you.